Be able to watch what's going on, but I'll have to report from outside in terms of physical feedback to you verbally. Thank you. Over to you, Sarah.
Thanks, John. What we're going to see there is, of course, a hernia repair operation. But when most of us think of medically inflicted pain, immediately we think, of course, of the dentist. Fear of dental pain actually prevents many people from getting any treatment, and hypnosis can be used there to overcome pain too.
In Glasgow, dentist Mike Gow and his partner Abid Fakir are pushing the boundaries in the way they use hypnosis to manage pain. For the first time, they're going to attempt advanced dental surgery with no other anaesthetic. The procedure to insert an implant will involve cutting into the gum and drilling into the jawbone.
As far as we're aware, this is the first time this has ever been carried out, this procedure with no local anaesthetic.
Patient Wendy Spencer has been fully prepared and knows what to expect.
It's not really saying that there's not going to be any pain, it's just how do you deal with it. So if you can then manage that and dissociate yourself from that, then it's great.
The perception of pain and somebody's emotions are very intrinsically linked, and certainly you do find with patients who are anxious that they report the experience of pain being greater. With hypnosis, you're able to relax the person, and therefore their experience of any unpleasant stimulus is less. So how are you feeling, Wendy? Are you okay?
I'm fine.
Yeah, right. Good stuff. This is going to be excellent, okay? Really positive experience. I wonder if you can imagine that marble staircase that you talked about before. Can you see that staircase? Yeah. I wonder if you can just start slowly walking down these stairs. You can find yourself in a place where your mind can be completely comfortable. All the normal sounds and noises of the practice, just allow them to fade away as you feel the drapes going on. It's just as if you're being tucked into bed. It's a nice, comfortable feeling. Lift both of your hands up and have the palms of the hands facing each other.
After 15 minutes of relaxation, Mike uses a technique that appears to transfer numbness from Wendy's fingers to her mouth.
By thinking about the sensations and the feelings in the right hand, you can begin to change them. Can you feel any differences starting to happen there?
It's quite pins and needles.
Kind of getting pins and needles, okay. Just allow that feeling to grow stronger and just spread into the fingers, down through the knuckles and into the fingertips. So that when I pinch just on your left hand there, that just feels normal, doesn't it? If I pinch on the right hand there, that can feel different. How does that feel?
It just kind of feels kind of like rubber.
Rubbery, almost as if you had a big pair of marigolds on. Just raising your hand up and just allowing any sensations drain down the hand now, so this hand becomes twice as tingly as it did before. Just feel these feelings getting stronger and stronger. Can you feel that? And I wonder if, when you move this up to your gum level, up at the area we're going to be working on, and just placing the thumb on the roof of your mouth side and placing the tip of your finger on the other side and just squeezing in that area, and just make sure you pass all that coldness, all that tingly feeling into and around this area, okay? And you can move your hand up now and do that. Just move the hand all the way up and just take all the time you need just to allow that feeling to pass from the hand and from the fingers up into the tissues around this area. How would you describe the feelings in the left side of your face right now?
You're just stiff, as if when you've burnt your finger and your skin goes tight.
Wendy uses the idea of a pain dial, registering from 0 to 10 to report the intensity of her pain. Mike uses this visualization to help her turn it down.
And just writing down where things are at on this dial, just that 0. That's perfect. Very, very good. That's fantastic. Very good. Okay. You might hear some funny noises, but you know for a fact you don't need to let them worry you. If you open nice and wide when you're ready, just notice how comfortable this can be if you allow it to be. Just noticing the noises. Good, that's fabulous. Wendy, if you just write down a number for me there. Just write me a wee number, a 0. Wow, that's fabulous.
With Wendy prepared, but using no anaesthetic, Abid now starts the surgery, while Mike continues the hypnosis.
Over to the next drill. Okay, so just relax for me. I feel a lot of water in there.
Lots of water, lots of pressure. Just write me another number down there. Whereabouts are things on the dial? 2, that's fine.
Wendy, I'm just going to introduce the first drill.
A bit of vibration and pressure. Totally cold, totally stiff, and perhaps as this begins, you can feel it becoming even more stiff there, even more cold. Just focus on that dial as you turn it down. That's fine. Pressure and movement.
That's excellent. Wendy, we made a small wee cut in the gum, and we're going to close that together with a single stitch.
Just stay completely relaxed. Just feeling the pressure and the movement. And if you just write me another number down there, Wendy. Is that a 0, yeah? Mm-hmm. Yeah, excellent.
From first incision, the operation takes 25 minutes.
In a moment or two, I'll be counting back again from 10 to 1, and over the coming days, you'll be surprised by how quickly things will heal and by how comfortable things feel over the next few days. 3, 2, 1, and just open your eyes wide awake, fully awake. Excellent. Well done. That was fabulous. Congratulations. You feeling okay, yeah? Relaxed?
Yeah, it's fine. Yeah, all right. I remember it all. I felt it, yes, I did feel it, and there was bits where I thought that was quite sore, but not sore enough that I couldn't manage it.
I was totally blown away by the whole procedure. I honestly thought we weren't going to manage the full thing, but the patient and Michael's hypnosis was fantastic.
Well, Mike Gow, who you saw in that film there, is here in the studio with me, and I'll be talking to him in a minute, but I believe that Dale's ready to go through into the theatre now.
Well, as Sarah's just said, Dale, in fact, is definitely coming into the theatre now. He's been in a hypnotic trance now for a few minutes with John Butler. We can just see him. He's being wheeled in slowly now. Tom joins me again. Tom, what sort of physical state is the patient in now?
Well, he's comfortable, very relaxed and partially anaesthetised, and then we'll get him onto the table, and when he's in the correct position, then we'll get the monitoring going,
right,
so that we know everything is safe. Then John will deepen the anaesthetic, so that then he'll be ready for the operation, and John will give us a signal whenever he's ready for us to start, so that we know everything's correct for the safety point of view and the comfort point of view.
So in a sense, he's not your patient yet. He's still under the care of John Butler.
Oh yes, and with it being a slightly unusual circumstance, then I think that it's John Butler that should be the captain of the ship, as it were, to make sure that we've got everything right from the comfort and safety point of view, ready for me to start.
What are your thoughts at the moment?
No, we're very much looking forward to it. It's a technique we've done before, and I think is well worthy of investigation, and we'll see how it goes today. But if there's a problem, comfort is an important thing, and we'll give him whatever anaesthetic he needs, but I think it's probably going to be either a small amount or none at all.
It is extraordinary, isn't it? I have to keep on pinching myself that this is a patient who's just about to have fairly serious surgery, invasive surgery, under hypnosis, no anaesthetic, and I mean, he looks like, he looks as if he's unconscious, but he isn't, is he?
Oh no, he's completely conscious and would be able to talk to you, but obviously we don't want to disturb his concentration, and so we need to be as quiet as possible while John is deepening the hypnotic anaesthetic to the level required for surgery.
Absolutely. Okay, I'll leave you to it, Tom. Thanks
No
very
problem.
much.
Anytime.
Okay, well, tense moments here. We've got the patient into the theatre. He is looking very comfortable, and it's back to you, Sarah.
Okay, well, while he gets ready for that surgery, I've still got Mike Gow, who we saw in that film about dentistry with me. Is it very common to use hypnosis in the dentist surgery?
It's certainly starting to become more common. More and more dentists are undergoing the training offered by the hypnosis societies, such as the British Society of Medical and Dental Hypnosis in Scotland and England, BSEC, and the courses at University College London, run by Professor Oakley.
But when you suggest to a patient that they might want to have dental treatment, not with any pain-killing drugs, but with hypnosis instead, what kind of reaction do you normally get?
Well, it's not generally something we would offer that often, you know, because most of the time people would have it done with anaesthetics. Usually if we're using hypnosis, it would be in combination with anaesthetics.
People must be pretty surprised when you suggest hypnosis at all.
Oh, well, certainly, and for something like this, I think most people would be fairly taken aback, yeah.
Well, also with me here is Professor Oakley, who's the director of the Hypnosis Unit at University College London. We saw one technique being practiced there. What different ways are there to use hypnosis to put people in a state where you could operate on them or perform a dental treatment?
Well, there are a whole variety of different techniques. The core feature is that people become focused and absorbed on some thought or idea. And once they're in that focused, absorbed state, the trance-like state, then you can use suggestion to produce things like analgesia or enlightened imagery or whatever's needed for the particular procedures.
And so you use different kind of procedures. We heard you talking about a marble staircase in that
Sure.
film. What did that mean?
That was a kind of basic deepening technique that allowed the patient to go into what's called her special place, just where she could be completely relaxed. But this is imagery that she's chosen and come up with herself, and it's not led by myself. This is something that she's,
How easy is it to teach these kind of techniques? Because you weren't a hypnotist to begin with, you were a dentist to start with. How
Sure.
common is it for somebody to be able to learn it that well?
The techniques themselves are not that difficult. How to apply them in particular settings is, and the sort of people who would respond better to hypnosis is important to determine that in individual cases. The actual techniques I learn them on people like Mike, and we also teach psychologists and medics to use hypnosis in their professions as well.
So say somebody involved in this tonight, the anaesthetist we saw there, Angela, for instance, becomes convinced by this. You could teach her to use these techniques, could you? And then she could do it in her own surgical procedures?
Yeah, I think that would be ideal. For the anaesthetist to be the person who delivers the hypnosis means they have the control of whether they use some anaesthesia, no anaesthesia or whatever, and that they're obviously on hand, and you don't need an extra person in the theatre.
Okay, David, thanks for that. We'll be talking more about this after the break, and we'll be watching the operation begin.